Hello. Thank you for joining us this morning. I want to acknowledge that we are gathered on the traditional territory of the signatories of Treaty 6, and I acknowledge the Métis people who share a deep connection with this land. My name is Cam Heenan, and I am the Alberta NDP candidate for Leduc-Beaumont. I want to take a moment to thank those fighting wildfires across Alberta, and all those who are opening their homes, their hearts, and volunteering to support their neighbors. As Albertans, we care for each other, and we lend a helping hand to those in need. I became a paramedic because when people need help, I want to be there for them. It's a meaningful job, but it is a tough one. We see some pretty difficult things, and we hear the terror in parents' voices when their child is in an emergency. Today, I have a story from a constituent that I want to read to you. This is really hard to share, but I have to say something. 2 weeks ago, out of nowhere, our beautiful toddler stopped breathing. We waited 32 minutes for an ambulance to arrive, and every single second felt like a day. Thank goodness a fire truck reached us sooner than the ambulance and managed to regulate our son's breathing. I don't know what would have happened otherwise. When the ambulance finally arrived, we were taken to the stollery, but we weren't seen by a doctor for over 8 hours. We waited with our 2-year-old all night from 10:45 p.m. until 6:45 a.m. How can you have to wait that long when your child is struggling to breathe? While we waited, we actually witnessed 4 families leave and go elsewhere for medical care. The healthcare workers who saw us were amazing, and I'm so relieved that our son is okay now, but I can't begin to describe how scary this was. Something is very wrong with our healthcare. No parent should have to go through what we went through. Stories like these are too common. Long waits for ambulances, long waits in ERs, and long waits for treatment. And they weigh on us as paramedics. Many of us have PTSD, and the current stress and culture is driving people away from the profession. I have been to more funerals than retirement parties. These are my colleagues, my friends, fellow Albertans, trying to help each other get through some of the most difficult moments of their lives. Healthcare needs a holistic, comprehensive approach to solving this crisis, and the Alberta NDP has a plan, one that focuses on patients, one that focuses on caring for those who care for others. It's time. I'll now turn it over to my colleague, David Shepherd, who has been a steadfast advocate for better healthcare.
Well, thank you, Cam. You know, it's heartbreaking to hear how the healthcare crisis continues to be so difficult for patients, families, and for paramedics. Albertans need to trust that when they call 911 in an emergency, dispatch will answer and an ambulance will be there within minutes. And they need to trust that when they get to the hospital, they will be seen faster. Under the UCP, Albertans don't have that trust. Indeed, over the last few years, we've seen healthcare in crises as the UCP has picked fights with doctors, nurses, and EMS. This has led to burnout and health professionals quitting, switching careers, or choosing to leave our province. The UCP's bad decisions have led to a crisis where hospitals are closed or services are disrupted due to staffing shortages across Alberta. Families are waiting for ambulances. Families are left waiting for lab work. And 800,000 Albertans are waiting for a family doctor. When you don't have a family doctor to see for regular checkups, or when you start feeling unwell, you can let things go too long without getting a health check. You start thinking, well, it's not bad enough to go to the ER, and maybe put things off until sometimes it gets too late. That ends up creating more demand for EMS and more pressure in our emergency rooms. We need to reduce pressure, not increase it. The Alberta NDP have a plan to fix healthcare in Alberta. It's a comprehensive plan, and it starts with respect. Instead of fighting with doctors, nurses, and EMS professionals, we'll respect them, and we'll work to recruit them. And we'll make sure every Albertan who needs a family doctor will get one, and they'll never have to pay for it. Through our Family Health Team's plan, Albertans will get access to the medical support they need under one roof, because comprehensive care is better care. And more doctors will provide evening and weekend care, because your kids don't get sick on a 9-to-5 schedule. We'll increase home care so 20,000 more seniors can stay in their homes. Another way to help keep seniors, and frankly all Albertans, healthy in their homes is to receive care by enhancing the community paramedic program. Community paramedics provide care from suturing to lab work without needing to visit a hospital. That means more Albertans get treatment and support at home instead of waiting in hospital emergency rooms for hours. Today, we're also announcing that we will expand the community paramedic program by adding 8 more units in Calgary and Edmonton and 8 more units to serve rural communities across the province. Over 4 years, those 16 units will support an estimated 18,000 visits for Albertans. That would result in $20 million of avoided costs in reduced ER visits, EMS transport, and acute care stays. We will continue with and expand community response units with cross-trained firefighter paramedics to provide medical first response on-site close to home. These investments aren't just good for patients, they're good for paramedics too. Being a paramedic is a rewarding and purposeful career. But without respect, fewer Albertans want to enter it. That's why we'll prioritize staff well-being and ensure that paramedics are working closer to home by reviewing dispatch to consider how we can enable workers to stay closer to their home post. We'll end the practices of paramedics working whole shifts in mall parking lots and shifts that always run late, making it impossible to get to the daycare on time for pickup because they're working in a different city away from home. Through our commitment to 10,000 new post-secondary spaces for health professions over the next 4 years, we'll also train more paramedics. Additionally, we have to provide more opportunities for career advancement and upgrading qualifications. And we'll recruit more paramedics with up to $10,000 in signing bonuses, and we'll retain them with additional incentives. The UCP have created Band-Aid solutions, but what we need is a comprehensive, long-term sustainable plan. And that's what we will deliver. We'll keep the Alberta EMS Provincial Advisory Committee together, and we will task it with immediate and medium-term solutions to keep paramedics closer to home, to be able to respond locally, and so that paramedics have a local home base where they can rest and recuperate, and so that you can trust that when you call, an ambulance will be there in minutes. Thank you, and we're happy to take any questions.
So we'll open up to questions now. We'll first start with people in person. We'll now go to the Zoom. Please use the raise hand function by clicking the raise hand, or *9 by the phone, as well as please identify who you are and what affiliate. We'll go to our first caller.
Recently had the distinct displeasure of visiting what's called the ICT at the University of Alberta Hospital, which is basically like a dumping ground for patients so that paramedics don't have to stay with the patients. They can leave them with nurses. It's in a garage. It's an interesting space. I'm wondering if you would retain the current UCP policy of having paramedics hand off patients at hospitals.
So I'm sorry to hear of the state of that facility, Janet. And we've certainly seen throughout this crisis of healthcare under the UCP, folks receiving care in hallways, patients being bedded on floors. We've seen conditions that Albertans should not face when they are seeking care. And it all comes down to the same thing. The UCP repeatedly puts their political interests ahead of the interests of public health, and indeed the quality of care. And that is what we have seen particularly under Danielle Smith, as she has set particular targets that she wanted to hit to claim that they have fixed healthcare, as we see them out on the campaign trail bragging about now. But the fact is they have simply shuffled problems into other parts of the system. We continue to face the same critical staffing shortages, and indeed, as you note, people are facing a lower, unacceptable quality of care. So in Alberta NDP government, I think we'd immediately want to review that situation. I haven't had a chance to visit this facility to see what these impacts are. We'd want to talk with the folks on the front lines, talk with the patients who are experiencing this. And indeed, if this is causing, I guess, more problems than it is actually intended to solve, if it is not leading to comprehensive solutions, we would have to look at other options.
Do you have a follow-up, Janet?
Just looking for a bit more clarity there. I didn't really hear whether or not, like,
I understand.
Do you like this policy right now of getting the paramedics turned over on the road? Because it seems to have helped resolve the red alerts issue, but it just seems to have moved the problem elsewhere.
I hear you, Janet. So what I would say is absolutely, it is essential that we get paramedics out of the emergency room back on the road as quickly as possible. Everybody acknowledges that has been a problem in the system that needs to be addressed. However, that should not be done at the cost of the quality of care that individuals are receiving. Nor should that be done if it is just creating more pressure in other parts of the system that could lead to other issues. So I know you're asking me for a definitive answer. Would we cancel this program outright? What I am saying is I do not have the data and the information to be able to state how effective this program has been or what its full impacts have been. But an Alberta NDP government would absolutely be committed to immediately reviewing that program, looking at what issues there may be, and taking steps to correct if necessary. And as I said, we want to continue the Alberta EMS Provincial Advisory Committee so that we can talk with paramedics, folks on the front lines like Cam, as well as folks from other parts of the system, so that we can understand how we can best achieve the goal, which is a good one, of getting paramedics out of emergency rooms and back on the road as quickly as possible, without compromising safety, without compromising the quality of care for patients, and without causing increased pressure in other parts of the system.
We'll go to our next caller. Are you able to unmute, caller?
Hi, this is Susan Zielinski at the Red Deer Advocate. I was hoping I could get a comment on the Parkland Institute report regarding surgery capacity and I guess the state of public health care.
Was there a specific part of the report, Susan? I'll be honest, I have not had the opportunity to read it yet myself. Was there a particular portion of it that you wanted to get comment on?
I just guess the concerns about the expansion of private surgical facilities and how that's impacting public hospitals and their surgery programs.
Certainly. Thank you. What we have been seeing so far, from certainly some of the contracts that we have seen signed recently in Calgary and some of the actions the government has taken in response to that, is that once again, the government seems to be putting their political objectives ahead of actually providing better care for Albertans. We had a government that chose to go to war with physicians and drove anesthesiologists out of the province of Alberta. We have a shortage and multiple facilities across the province. That is one of the chief bottlenecks that we have in being able to perform surgeries. That actually, and a loss also of operating room nurses. And again, this is the government that tried to roll back the wages of nurses in the midst of the pandemic, has pushed them to their limits and utterly exhausted them. So by fixating on a drastic expansion of privately owned and operated surgical facilities, facilities that are operated for profit by corporate shareholders, what we then see is a creation of more space that is going to pull people out of our public system. And indeed, we have rumors of that beginning to already happen in Calgary, where the government has come out and said that they are in fact mandating anesthesiologists to leave public surgeries, public hospitals, to go to work in private surgical facilities to meet quotas that have been assigned and that have been promised in terms of the number of surgeries those facilities would get to perform. So ultimately, we do not see a government who is thoughtfully trying to work comprehensively to improve access for all Albertans, but indeed a government that has chosen to actively undermine our public health care system to squeeze more private profit out of our public health care. So in Alberta NDP government, we will be focused on addressing wait times through investment in publicly owned and operated facilities. We can achieve all of the same efficiencies. In fact, they do right here next to the Royal Alec Hospital. There is a bone and joint center here. that follows all the same procedures that are done in these corporately owned facilities, but it is done without the need to take additional profit to pad the pockets of corporate shareholders. So that will be the way the Alberta NDP government will move forward, with more investments in our publicly owned, public operated surgical facilities, and also in working together with frontline healthcare workers to build this as a province that shows respect to doctors, nurses, all of the folks who make these systems possible.
Do you have a follow-up?
I'm just wondering if it would be difficult to switch direction from the UCP focus on private facilities back to public if NDP was elected.
So, an Alberta NDP government, we are going to be thoughtful, practical, and pragmatic. We are not looking to create chaos the way the UCP government did by tearing up systems, tearing up programs, simply on an ideological whim. So we will take a look at what we have available. And during our time in government, we did not close a single privately owned or operated surgical facility. We did not cancel any contracts. We worked with the system that was in place and made further investments to increase access to care. That is the intention of an Alberta NDP government. We will take a close look at what we have available. We will work with the resources that are currently available, and we will look for new opportunities that are publicly owned and publicly operated.
We'll go to our next caller.
Morning, David Dean from CP here. Can I ask you about this Jennifer Johnson thing? It looks like the UCP is rejecting your call to have her recalled as a candidate. They're saying her comments were about the United States, not Alberta. What do you think?
It's quite clear from when you listen to the full dialogue, and I've listened to some of the recordings, that they are talking about a specific school in Red Deer. They're talking about specific things here in the province of Alberta. So it's really a disgusting dodge for them to try to make this claim that the disgusting comments that Jennifer Johnson made. Now let's be clear, she literally compared children, transgender children in schools, to putting a scoop of feces in your chocolate chip cookie batter. That was the literal comparison she made. So let's be absolutely clear. She was talking about Alberta and Alberta schools. She made disgusting, unacceptable comments from, frankly, any individual, let alone someone who aspires to public office. And the fact that as we stand here today on the International Day against transphobia, homophobia, biphobia, Danielle Smith and the UCP cannot step up and condemn these comments, even make an actual apology, let alone do the right thing and remove this candidate, shows that they are not fit to govern this province and cannot represent the full diversity of individuals who deserve to be respected and protected here.
Do you have a follow-up, Dean?
Yeah. If you watch the video of Danielle Smith's interview with Take Back Alberta just before she wins the party leadership last October, she made it very clear she's pro-LGBTQ. So does that give you any comfort here?
Whatever the Premier's own views are, and I will acknowledge that in the past, she has been openly supportive of the LGBTQ2S+ community. But the Premier has said it herself. Don't judge me by what I said. Judge me by what I do. So here is the opportunity for Danielle Smith to take action. So far, she has taken none. So by her own declaration, we are to take her by what she does now, today, not what she said in the past. So by that context, her words are meaningless. We need to see real action taken against a candidate who has promoted disgusting transphobic views.
We'll go to our next caller.
Hi there, Catherine Rakowski, Alberta Today. So I'm wondering whether you would bring in some transparency measures. I know you'd asked for the UCP to publish when there's red alerts happening. I know that HSAA has called for a daily release of unfilled shifts. Is that kind of data reporting something that the NDP would promise?
So one of our commitments was to bring back a private member's bill that our leader, Rachel Notley, actually introduced in the legislature in December. So that bill will set clear reporting standards for the government of Alberta on a number of key metrics in the healthcare system. So that bill was brought forward. It was unfortunately shot down by the UCP government, who said we have enough transparency already. The fact is, if we want to truly address the problems in our healthcare system, and we truly want to ensure that we are taking actions that are comprehensive and yield real results, we need to be reporting data and we need to have fair, accurate measurement and transparency. So an Alberta NDP government is absolutely committed to passing that legislation and putting that in place. Now, as to which specific metrics, now there certainly would be some metrics around EMS. There'd be metrics around access to a family doctor, ER wait times, a few other things. To determine exactly which metrics and how those metrics should be measured, what the benchmark should be, we would strike a committee. We would bring folks together, a task force, including frontline folks like Cam here, folks from their elected representatives from the provincial healthcare unions, Alberta patients and families, and other experts in the system to help us determine what those would be. So certainly there's the possibility that things around red alerts or unfilled shifts might be determined to be good measures to be reporting to provide transparency in that system, and we look forward to the opportunity to have that discussion.
Do you have a follow-up, Catherine?
Yeah, and another thing you brought up as MLA that I'm wondering if you're carrying on to the campaign, there's a call to offer full-time positions to paramedics. And to increase access to supervised consumption sites, because a lot of this EMS calls are overdoses. Just wondering if some of those things that you had asked of the government are now things that you would promise to do should you form the next government.
So absolutely, we would follow through on the commitments that we've been calling for. And it sort of ties in with all these pieces. As we've said, we intend to launch the most robust recruitment program we've ever seen in the province of Alberta. And certainly as part of that, I think it would be reasonable to follow through, as we have called for, in offering all casual paramedics the opportunity to work full-time, have the dignity of a full salary and benefits instead of these 89-day contracts. And certainly we, as the Alberta NDP, are dedicated to addressing the issues with drug poisoning, so many of which happen right here in my constituency. That will include investments on all parts of the spectrum of resources for individuals who are dealing with substance use. So indeed that would mean ensuring we have appropriate capacity within supervised consumption sites and appropriate supports in harm reduction, all the way through to ensuring that many of the promises that are made by the UCP government in terms of opening more recovery spaces and beds for individuals who are going through that process are actually funded and followed through on.
Perfect. So we'll do one more pass for questions, first in person and on the Zoom. Janet French.
I'm back.
Yes.
David, if these private surgical centers are such a fragmentation of the system that are drawing resources away, why would you campaign on keeping them?
So again, Janet, what we are saying is, unlike the UCP, we are not going to make hard ideological promises that may create more chaos in the system. I have not seen the contracts that have been signed with these facilities. I do not know all of the pieces that are involved. Well, I guess some portions of these contracts have been publicly posted. But there are other pieces which we simply do not know or have enough detail about. So I think in Alberta NDP government, we're absolutely going to review contacts in place. For example, we've had many issues with Dynalife in Calgary. We are seeing real issues with weeks and weeks and weeks of wait times for simple blood work. We will review that contract to see how we can best hold Dynalife accountable to deliver the services that they had promised and are contracted to provide without undue impact to other parts of the system. We will take a similar approach with chartered surgical facilities. We will take a look at the contracts, we will see what services they are providing, we will see what the need is for Albertans, and we will determine what is the best way to move forward to provide both the services that Albertans need to reduce wait times, but also ensure we're getting the best results for the dollar and not doing harm in other parts of the healthcare system.
Just to follow up on that, so am I hearing you say that reversing, like paying a penalty to get out of the contract without like payment is an option? I mean, would that not just throw further disarray into the system of, you know, re-recruiting those lab workers back and getting the labs up and running?
What I said, Janet, is that we will review that contract to ensure that Albertans are getting the services that were promised, to ensure that Dynalife is living up to its contract. And an Alberta NDP government will not take any action which is going to cause further disruption in the healthcare system, that will add to the great amount of chaos that was already been caused by the UCP government. But we will ensure that we are getting the best value for Albertans and that they are being delivered the healthcare services they deserve and depend on.
With seeing no more questions, that concludes today's press conference. Thank you very much.